ultrasound is usually the first imaging modality used. Intravenous urography and body surface urography are also useful for characterization of the collecting system in vesical uretral reflux. Moreover, intravenous urography has been replaced by CT urography and MR urography. These imaging methods not only allow direct visualization of the collecting system, but also demonstrate the function of the kidneys, vascular anatomy, adjacent structures, and complications. This study is aimed to evaluate the role of CT scan in various congenital upper urinary tract anomalies and their clinical significance, and to identify the spectrum of radiologic findings related to congenital anomalies of the kidneys and ureters. It was a time-bound observational study which was run over a period of 4 months from June 2023 to September 2023. Total 32 patients were included in the study who were referred to the Department of Radiology, MGM Aurangabad. All patients referred to the Department of Radiology for contrast and CT scan were included in the study, and chronic kidney disease patients and patients with serum creatinine more than 1.6 were excluded. In my study, the most common congenital anomaly found was ectopic kidneys, out of which 2/3 patients were of simple ectopia and 1/3 patients were of cross-fused ectopia. And ectopic kidneys and duplex collecting system was also the most common anomaly found. Then horseshoe kidneys and malrotated kidney were the next common anomalies, and followed by renal agenesis. Ectopic kidneys, this is in the first image, this is a coronal image of the contrast enhanced CT scan, wherein the left kidney is found malrotated and lying in the pelvis. Ectopic kidneys can be either simple renal ectopia, wherein the kidney lies on the same side of the abdomen but not in the renal fossa, and in cross-fused ectopia the kidney is found in the opposite side of the abdomen. The original side of the kidney can be deciphered by the insertion of the ureter in the bladder. Horseshoe kidneys, in the first axial image of the contrast enhanced CT scan, the two kidneys can be found fused in front of the aorta. The coronal image shows that the kidneys are fused at their lower poles. Horseshoe kidney refers to a condition in which the kidneys are fused at the lower most commonly at the lower poles with a renal parenchymal or a fibrous isthmus. During the ascent, the connecting isthmus of the fused kidneys gets trapped behind the inferior mesenteric artery. Therefore, the kidneys cannot ascend to the lumbar region. Malrotated kidney, here in the coronal image, normally the pelvis of the kidney should be facing medially. Here the pelvis is facing slightly anteriorly. Types of malrotated kidneys can be non-rotation or incomplete rotation, wherein the pelvis is facing anteriorly or slightly between the anterior and medial direction. In reverse rotation, the pelvis can be seen facing laterally, and in hyperrotation, there is extreme lateral rotation of the kidneys. Renal agenesis, it refers to complete loss of one or both the kidneys without identifiable rudimentary tissue. Multiple syndromes are associated with renal agenesis, and long-term sequelae includes chronic kidney disease. In this image, the right kidney is not found in the right renal fossa. It was not found anywhere else in the body. So this was a case of right renal agenesis. Duplex collecting system, it is the most common congenital ureteral abnormality wherein there is presence of two pelagolacial systems. It can be either complete or incomplete. Incomplete duplex collecting systems, there will be complete bifurcation of the ureter, and in incomplete type, the two ureters get fused before inserting into the vesico-ureteric junction. In complete duplex collecting systems, the lower pole follows the normal anatomic structure with an orthotopic ureter implantation, while the ureter of the upper pole has an ectopic bladder implantation. Other variations which are seen are persistent fetal lobulations, hypertrophied column of Bertini, wherein the cortex hypertrophies and deeps down into the medulla, and dromedary hump. When more than one kidneys are found in the body, it is termed as supernumerary kidneys. A supernumerary kidney is normally smaller than the native kidney, and it has its own arterial supply originating from the aorta or common iliac artery. The conclusion was that comprehension of congenital anomalies of urinary tract development and anatomic changes they can cause is important. The imaging findings and possible complications of these anomalies aid in accurate diagnosis and optimal treatment. Associated Mullerian and other anomalies also need to be looked for to rule out various syndromes. These are the references which are used. Thank you, sir. Yes, ultrasound was. Yes, sir. As in, many of the patients have got their ultrasound done outside also. So the patient would come directly for the CT scan to our department. So in that cases.
Okay. No, I'm asking you this because do you need to tailor your study in any way, CT study? If you feel that there is an agenesis of the kidney, do you need to tailor or do something with the protocol of the CT, or it's a routine CT?
No, we would take the nephrogenic protocol then.
What do you do on the scanner? Like what changes you make? Something with the delay, something with the contrast injection rate, or something like that. Technical
so the
issues.
phases, the corticomedullary phase would be taken at 30 to 40 seconds, 10 to 20 seconds. Then nephrogenic phase would be taken at 30 to 40 seconds, and then excretory phase would be taken at 5 to 10 minutes.
Okay.
I have 2-3 questions for you. One is, you have done this study to see these anomalies. So I think strongly ultrasound can also majorly pick up all this. So
yes,
your study was done in infant age group or adult age group?
Sir, actually these were many of them were incidentally detected findings.
No. All these studies which you have shown, these are all adult cases or pediatric?
So all of them were included.
All, because it is a significant thing to at a pediatric age group to do a CT IVU and to do all this where ultrasound can pick major anomalies. So that was my question. Second, today you all do lot of CT IVUs. Our time CT IVU was not there. At least now Ajay and all work a lot on it. I wanted to know, there used to always be a question that calacial abnormalities were better picked up on conventional IVU against other CT that time. What is now your current experience? Calacial abnormalities. Do you think still conventional IVU, calacial abnormalities are better picked up, or CT IVU has now become gold standard?
So CT IVU has
become gold standard.
Yes.
So it can even pick up calacial abnormalities and everything now.
Yes, sir.
So that's what I was wondering, because giving such amount of contrast to just pick up anomalies like this, when you can qualify them on ultrasound fairly good, maybe yes, sometimes some reports come ambiguous and then we confirm them on CT, but in pediatric age group we avoid CT as much as we possible. Thanks.
Thank you, sir.